Greetings to everyone. Welcome back to my educational channel on biology. In this video, we will discuss health issues related to poor eating habits. For example, anorexia nervosa and gastritis. So let's get started. The learning standards are as follows. 9.7 Health issues related to the digestive system and eating habits. So we should be able to correlate and discuss health issues that are related to poor eating habits. Now, there are 8 examples of these health issues that are related to poor eating habits that are mentioned in the syllabus, but only 4 are explained in the textbook. And these are anorexia nervosa, bulimia nervosa, muscle dysmorphia, and gastritis. So the first 3 has been tested in the 2023 paper, SPM paper, right? We must know all this in detail. However, there are another 4 here: acid reflux, obesity, type 2 diabetes, and PICA. They are not explained in the textbook, but you are required to know them because it's mentioned in the syllabus. All right. So I will explain briefly these 4 health issues after I've explained the first 4. All right. So the first 4 that you must know are these first 4 here. Okay, that is mentioned in the textbook. Then with extra time, you can look at all these 4 topics, 4 health issues, the second set, which is still important and can be tested in SPM. So for our concept map, Chapter 9, Nutrition and the Human Digestive System, we have already discussed the digestive system and the processes concerned here, balanced diet too, and we had health issues related to the digestive system and eating habits. So we are at this part here. In the last video, we have already discussed issues related to defecation, right? And the importance of fiber. So now we are here. Health issues related to eating habits, poor eating habits. So here's the introduction. Health issues related to eating habits. Apart from a balanced diet, eating habits also play an important role in fulfilling our energy requirements and maintaining our health. So what if a person has poor eating habits? So poor eating habits and an imbalanced diet can cause health problems such as gastritis, muscle dysmorphia, anorexia nervosa, bulimia nervosa, type 2 diabetes, obesity, acid reflux, and PICA. Now the first 4 will be discussed in more detail, right? From gastritis to bulimia nervosa. And the second 4, type 2 diabetes until PICA, we will still discuss, and there'll be a summary. If you want to know further about these topics, you can comment below. All right, I can do a more detailed explanation for these 4, right? But we still need to know something about these 4 issues. Okay, so I will summarize it in a table for you at the end of this video. So health issues or diseases are constantly asked in the biology syllabus, in the SPM and other exams. Now, how to get full marks for questions on health issues and diseases? Here are the tips to get full marks. For each disease, study and memorize the definition, the causes or cause, symptoms and effects, and then preventive measures and treatment. Preventive measures are taken to prevent oneself from getting the disease, from suffering from the disease, whereas treatment are for those who are already suffering from the disease and what can be done to improve their situation. So for example, in SPM 2023, students also ask about ways to help a patient who has anorexia nervosa or bulimia and so forth, right? So in the SPM past years, you will come across many types of diseases, and these are the 4 aspects that you must know: definition, cause, symptoms and effects, preventive measures, and treatment. For example, anorexia nervosa is defined as a serious eating disorder caused by a psychological problem where the patient feels that she is fat, okay, has a fear of growing fat, although she may be already thin. So there's an obsession with the weight. The first health issue related to poor eating habits is gastritis. So quite a number of people have experienced gastritis before. It is a condition in which the epithelial lining of the stomach, as seen here, becomes inflamed. That means red, swollen, and painful. Or eroded. That means the lining will thin down because of the cells being damaged. So what is the epithelial lining of the stomach? It is the uppermost layer inside the stomach, which is made up of epithelial cells. All right. Then how does it get inflamed? It gets inflamed if the lining is exposed to hydrochloric acid and enzymes like pepsin, especially hydrochloric acid, which is very acidic. Okay. So one of the reasons or causes is when a person eats at irregular meal times, sometimes eating at 1 o'clock in the afternoon, and then other times at 2 or 4 o'clock. They postpone their meal time, right? So if the stomach is used to digesting food at, say, 1 o'clock in the afternoon, it will still produce the gastric juice containing the hydrochloric acid at 1 o'clock every day, around that time, in anticipation of food, even though the stomach is empty. Then this acidic gastric juice containing the hydrochloric acid erodes the lining, the stomach lining, because the hydrochloric acid is very strong, okay, with a pH of 2 to 3, causing pain and inflammation. All right. So from a condition that's healthy, where the stomach wall is pink and healthy, the stomach lining is pink and healthy, it can become swollen, as shown here, inflamed and painful. All right. And in extreme cases, there may be a breach or a break in the stomach lining, and the gastric ulcer, which is an open sore, can form. All right. That can also bleed. So this will become even more painful. Now, another reason for gastritis is when a person is exposed to a lot of stress in the studies or at work. All right. So during the times of stress, hydrochloric acid is released from the stomach, from the gastric glands. All right. Excessive intake of alcohol is another cause, and a bacteria known as H. pylori or Helicobacter pylori. This bacteria infects the stomach lining and causes inflammation of the lining of the stomach. Symptoms and effects: abdominal pain. The person will feel abdominal pain, as shown here. Nausea, the feeling of wanting to vomit, and sometimes they will vomit. There's a loss of appetite, indigestion, and gastric ulcer. Okay, gastric ulcer can be detected also. So gastric ulcer is an open sore in the stomach lining. Treatment: doctor may recommend antacids, which are alkaline substances like magnesium hydroxide, to neutralize the stomach acid, the hydrochloric acid. So patients should avoid spicy and acidic food, alcohol, and coffee. So spicy and acidic food, like those that contain chilies, okay, like curry, and also those that have a lot of pepper, okay. And coffee is also acidic, so it can worsen the condition of the stomach. Now, if the gastritis is caused by the bacteria H. pylori, then doctors will recommend the consumption of antibiotics over a period of a few weeks to kill the bacteria. Okay, so tests can be done to test for the presence of this bacteria H. pylori, and then after the antibiotics are given, then tests are done again to make sure that all this bacteria is eliminated. The second health issue related to poor eating habit is anorexia nervosa. It's a serious eating disorder caused by a psychological problem. Okay, where the patient has distorted body image. She thinks that she's fat. When she looks in the mirror, she thinks that she's fat, although she may be very skinny or thin already. Okay, so she's obsessed with her body weight. Usually occurs in young girls or young women, and has a great fear of gaining weight. So refrains from eating, and she will try to avoid food in order to try to achieve the ideal body weight. But instead, she will starve herself and experience excessive weight loss and become very thin or emaciated, as seen in this picture here, right? Until the bones start to stick out and the face becomes sunken, right? Now, cause. The cause is a distorted body image, the wrong perception of themselves as being very fat, low self-esteem. They don't think much about themselves, all right? They don't think highly of themselves. And mental problem. It's a psychological or mental problem. Symptoms and effects: excessive weight loss until they become very skinny, nutrient deficiency because they are not eating enough food, okay, so they may lack calcium in the diet, and this can lead to osteoporosis or loss of bone mass, okay. And if they also don't take enough protein, then they will lose the fat and muscle. And this can cause damage to the heart, because the heart is a muscle. Infertility, that means no ability to bear children. Even the absence of menstruation or periods, and then if it's very serious, it can lead to death because they refrain from eating, they starve themselves. Treatment, they need to see a counselor or a psychiatrist who can help them by talking to them. So this is called psychotherapy or talk therapy. Then family members and friends can encourage them to eat a normal balanced diet, and even a nutritionist. They can consult a nutrition. The family can consult a nutritionist to plan a normal balanced diet, so that the patient can slowly revert back to eating the normal diet. Okay, by preparing the easily digestible foods for them. Okay, and so this is with the aim to regain the normal body mass. Okay, so that the BMI, the body mass index, is in the right normal range. So these patients need moral and emotional support to overcome the condition. This support can be provided by friends. So the third health issue is bulimia. It has nothing to do with bullying. So bulimia is an eating disorder too, like anorexia nervosa. Okay, so bulimia is an eating disorder and psychological problem in which a person eats a lot of food. So in this case, the patient does eat a lot of food. It's called binging, and then suddenly feel guilty, and then they'll go to the toilet as shown here to vomit. They put the fingers into the throat to induce vomiting. Okay, or they may take laxatives to cause diarrhea so that the food will pass out through the anus. Right. So laxative is a medicine that promotes bowel movement or defecation and can be used to relieve constipation. But in this case, for the bulimic patient, they eat the laxative not because they want to relieve constipation, okay, but they just want to get the food out of the body. So that's called purging oneself of food, to get rid of the food through laxatives or vomiting. Now, the cause is a distorted belief again about their own body shape and weight. So they think again that they are fat, and then it becomes a mental illness, and they are obsessed with controlling their body weight. But the difference between anorexia nervosa and bulimia is that in anorexia nervosa, the patient starves herself, she doesn't eat. Whereas in bulimia, the patient eats. First, they eat a lot, so that's called binging, and then they try to purge themselves of the food by vomiting or taking laxatives. So, symptoms and effects: extreme weight loss, malnutrition due to lack of nutrients, and then because they vomit out the food most of the time or pass out the food, okay? And then dehydration will occur because they are vomiting or they're having diarrhea, so they lose a lot of fluids. Digestive tract injury, cardiovascular disease, diseases of the heart and the arteries, and then kidney failure. So what's the treatment? It's similar to that for anorexia nervosa, okay? So examples are counseling, consulting a psychiatrist, which will help them to undergo psychotherapy. Then the nutritionist can be consulted, nutritionist, to plan a normal balanced diet for the patient and monitor, okay, to monitor the eating habits of the patient, okay, so that they can regain or achieve a normal body mass index, BMI, according to the readings of the scale. Give patient moral support to overcome depression. This is the role of the friends and the family, okay, to give the patient moral support to overcome depression. The next health condition related to poor eating habits is muscle dysmorphia. This is a mental health condition experienced by certain males in which the individual has a distorted perception and think that his body size is small with not enough muscle growth, even when he may already be large and muscular in structure, as seen in this picture here. All right, they still think that they are very thin, and they always have this obsession to exercise so that they become more and more muscular. Okay, so this is a mental health condition. The cause again is a distorted body image, like for anorexia nervosa and bulimia. So the patient feels that his body size is too small with not enough growth, so he will subject himself to excessive exercise, maybe keep going to the gym to train and do extreme weightlifting. Okay, so if the symptoms are extreme weightlifting and training, excessive exercise, and they may even try to consume the steroids, which are medication to build the muscles. But these steroids have side effects, bad side effects, and cannot be taken over long term. All right, and then they may eat a lot of muscle building supplements to try to achieve the ideal physique or body structure. So the treatment is again similar to anorexia nervosa and bulimia. Treatment is counseling. They need to consult a psychiatrist, then undergo the psychotherapy or talk therapy in order to change their perception, the perception of themselves, right? So the family and friends and the doctor should give the patient moral support, then encourage the patient to do the balanced exercise routines and not be extreme, like excessive. So consult nutritionists, encourage patient to eat normal balanced diet and avoid taking steroids. So here is a summary of the 4 health issues as discussed in the textbook, all right? Anorexia nervosa, bulimia nervosa, muscle dysmorphia, and gastritis. We have already discussed all this, and I just put it in a table form and summarize it for you, okay? Now, for example, anorexia nervosa, definition: the patient is obsessed with their own body weight. They have extreme avoidance of food due to fear of gaining weight. So although they are already thin, so they will starve themselves. The cause is a distorted body image, low self-esteem, and it's a psychological or mental problem. Symptoms: extreme weight loss, nutrient deficiency, heart damage, and maybe also loss of the menstrual periods. That means there's absence of menstruation, all right, due to malnutrition or nutrient deficiency. Bulimia nervosa. Again, the patient's obsessed with controlling the body weight, but in this case, they eat a lot and then vomit out or eat a laxative to induce diarrhea to occur. All right. Now, the cause is similar to that for anorexia nervosa, and the symptoms and effects. Bulimia. For bulimia, the patient suffers from dehydration because they lose a lot of body fluids through vomiting or diarrhea. Cardiovascular disease and kidney failure. For muscle dysmorphia, there's obsession with being muscular, feel that his own size is too small and there's not enough growth. So again, the cause is similar to the other two above, distorted body image, all right? Low self-esteem, psychological problem. Symptoms and effects. In this case, they carry out extreme weightlifting, excessive exercise, eat steroids, and eat the muscle building supplements. So for all these three, in the exam for SPM, I think 2023, the question asked was related to what can be done by a normal person to help these patients, right? So a friend, for example, can take them to the counselor, friend or relative, take them to see a professional counselor or psychiatrist so that they can be talked to and counseled to change their perception, the perception of themselves, right? To give moral support to them, okay? So friends and family can give them moral support and encourage them to eat a normal, balanced diet. Maybe they can consult the nutritionist, all right? So that they can go back to a normal, balanced diet to achieve the normal body mass index. Now, for gastritis, it's the inflammation of the stomach lining. So the cause is eating at irregular meal times, stress, and also the bacteria known as H. pylori. Symptoms: indigestion, nausea, vomiting, bloating, stomach ulcers or gastric ulcers, right? So what is the treatment? Treatment is to take the antacids or the alkaline substances to neutralize the acid, right? And then if it's due to H. pylori bacteria, they have to eat the antibiotics to kill the bacteria, okay? And they also have to make some changes to their lifestyle and remember to eat at regular meal times. So we have decided to include the other 4 health issues that were not discussed in the textbook, but is stated in the curriculum. So we need to know something about all these 4 issues. We must know the definition, cause, symptoms and effects, and treatment, in case they are asked in the SPM exam or the exam. So let's talk about these 4 issues. So apart from the first 4 issues, let's talk about PICA, obesity, type 2 diabetes, and acid reflux. Let's begin with PICA. PICA is a very strange habit where the person eats non-food items like, for example, soil or chalk or soap or paint that has no nutritional value at all. So it usually happens in children who have some mental health disorders or even in pregnant ladies. And the cause can be the lack of a certain nutrient like iron. Okay, and another cause, as we say, mental health disorders like autism in children and other disorders can cause them to have this habit of eating the non-food items. Symptoms and effects. They will suffer from digestive issues as they take in all these substances that are unhygienic, and also these substances may contain some toxins in them, right, like paint. Poisoning due to maybe the lead in the paint. Infections, if they eat the soil, it may contain bacteria, okay, that can cause infections. Treatment. So if it's due to nutrient deficiency, then the doctor will treat the deficiency, like deficiency in iron. So doctor will make sure that they get enough iron in their diet. Behavioral therapy to change their behavior, and they need a lot of psychological and moral support. Obesity. Obesity is a condition where there's excessive storage of body fat or storage of excessive body fat, okay? Storage of excess body fat that impairs health, where they have a lot of body fat that until their BMI, the body mass index, is more than or equals to 30. We will talk about this in the next slide. Now, the cause. Cause is overeating, and then inactivity or sedentary lifestyle. After eating, then you just become inactive, lie down, and don't exercise. Genetics and also hormonal imbalance can lead to obesity. Symptoms. Heart disease. So obesity can lead to a lot of serious health conditions like heart disease, diabetes mellitus, joint pain. Okay, they get joint pain in the knees and other parts because of their heavy body weight. Sleep apnea means that they will sleep and wake up at night suddenly. All right. So treatment, they need to change their diet and eat less fats, and also eat smaller quantities of food. Exercise, therapy, medication, and if all else fails, there is surgery. That is the gastric bypass surgery to reduce the size of the stomach. Type 2 diabetes. Definition. It is a condition where there is insulin resistance or insulin deficiency causing high blood sugar levels in the blood, right? Consistently high blood sugar levels. So why is it called type 2 diabetes? Because in this type of diabetes, usually the adults get it at the later stage, right? And they can still, some of them still produce the insulin. The pancreas produces the insulin, okay, produces insulin, but the cells do not respond to the insulin by taking up the sugars or glucose. Normally, if insulin is released into the blood, it will stimulate the cells, body cells, to absorb or take in more glucose from the blood for respiration so that they can produce energy, right? So that the blood sugar level will go down. But in a person with insulin resistance, the body cells do not respond to the insulin as well as in a normal person. So that means that the cells do not take up the sugar, excess sugar from the blood for respiration and so forth. All right. So that means the sugar level will build up in the blood. because it's not taken in by the cells. And then this causes the consistently high blood sugar levels. Cause poor diet, obesity. Poor diet means maybe eating a lot of sugary foods and sweet foods. Obesity can lead to type 2 diabetes. Inactivity, again, that means lack of exercise. And if a person has a family history of diabetes, then it's more likely that they will get diabetes because of their genetics, right? They inherit the genes from their parents that give them make them have a tendency to get this disease. Symptoms. So these symptoms you must know well. Frequent urination, fatigue or tiredness, slow healing of wounds. Slow healing of wounds. When you get a cut, the wound does not heal. Nerve damage, and even in serious cases, blindness and leg amputations. Treatment. Carry out lifestyle changes. For example, eat less sweet foods or sugary foods. Eat less the refined foods, all right? Like white flour, white bread, all these, they have lack of fiber, and they will cause the sugar level in the blood to increase suddenly, all right, after the patient eats the food. So white flour, white rice, white bread, all these items that are white, so-called white in color, they lack the fiber, which fiber can help to regulate the blood glucose level in the blood, as we have studied earlier. Insulin therapy means, for example, as you can see here, this patient is taking an insulin pen, which is actually like a syringe, to inject insulin into the stomach, into the blood. Okay, this will help to reduce the blood glucose level because insulin converts excess blood glucose into glycogen, which is stored in the liver. Now, let's go on to the last one, acid reflux or GERD. We don't need to know the full name for GERD, okay? So reflux means a condition where there's a backflow of something. The substance flow backwards and not in the normal direction. So acid reflux means the backflow of stomach acid into the esophagus. As you can see here, this is the stomach, and the acid, the gastric juice has been released with the hydrochloric acid inside for digestion. But somehow the esophageal sphincter here, which is a ring of muscle at this point here of the esophagus near to the stomach, it is weak, so it opens, and then this causes the stomach acid to move upwards. So this is called acid reflux. Okay, instead of being inside the stomach, it goes upwards. So this will cause a condition where the acid can sort of give a burning sensation in the chest area as it moves upwards. That's why it's called, the symptom is heartburn. Okay, that means a burning sensation in the esophagus caused by this acid, but it's near to the heart, so the patient feels something there, the stinging and burning sensation. So that's heartburn. Now, another cause of acid reflux is after eating a meal, the person goes and lies down. So this will cause the stomach acid to more easily flow into the esophagus. Okay, you sit up, then the force of gravity will pull down this acid, and it will not be so easy for the acid to flow upwards. Obesity can also lead to acid reflux. So symptoms: heartburn, a sour taste due to the acid flowing up into the mouth area. Okay, chest pain, actually is the burning sensation from the acid in the esophagus. Regurgitation, meaning like wanting to throw out some of the stuff that has been already swallowed. Hoarseness of throat caused by the acid, okay, that corrodes the tissues. So eat smaller meals, have an upright posture so that the gravity will pull the stomach acid downwards, all right, into the stomach. Antacids are the alkaline substances that neutralize the acids. Okay, and then proton pump inhibitors and surgery. Okay, now this is a graph showing you the blood sugar levels of two people after ingestion of 100 grams of glucose, probably eaten or drunk as a solution, all right, of glucose. So this is in relation to the condition called diabetes mellitus, the health issue called diabetes mellitus. Now let's look at this graph. This is a graph of the percentage of glucose in the blood of the patient against the time in minutes. So the glucose meal is taken at this point here in time, right? Starting from this point, you can see for a normal person, the blood glucose level starts to rise as the glucose is absorbed into the blood, all right? But after 30 minutes, the insulin is released from the pancreas, okay? Pancreas is stimulated to release insulin, and this will insulin will convert the excess blood glucose to glycogen. So the level of blood glucose decreases after that. And finally, after about 180 around there, the blood glucose level has reduced back to the normal level. Okay, so how about for C, a diabetes mellitus patient? At this point here, the glucose solution was drunk, and after that, the level of blood glucose increases very rapidly, way beyond the level for a normal person. All right, and even when insulin is secreted, it does not help to bring down the level very much. Okay, so that means even after 150 minutes, the level of blood glucose is still higher than normal. Okay, the normal blood glucose level is this one here, at this level. Okay, the average fasting level of blood sugar. So this is why the diabetes mellitus patient consistently has a high blood sugar level that can cause health problems like frequent urination, thirst, okay, very strong feeling of thirst, and then slow healing of wounds and so forth. So this is a serious health problem. So here I just want to conclude with this part on body mass index for those who suffer from obesity. Okay, so the body mass index is actually a vector or a calculation, okay, a figure or a data that helps us to identify those that are underweight, healthy, overweight, or obese. Okay, so the formula is BMI, body mass index, equals to the body weight of a person in kilograms divided by the height squared. The height must be in meters. Okay, for example, let's look at this question. Sarah is 1.60 meters tall and weighs 80 kilograms. She wants to know if she is considered overweight or obese. Okay, overweight is still not obese. Now, obese is when the BMI is above or equals to 30. So how would you help her find out? So calculate her body mass index by using this formula. So Sarah's BMI will be 80, that's the body weight, 80 kg, divided by 1.60 squared. That's the height squared, okay? Answer is 31.25. So she's considered obese based on the BMI chart. Right, that's all for this lesson. Thanks for viewing, and please do share, like, and subscribe to my channel. So all the best in your exams. Goodbye for now.